I'm super pleased with the government's decision to remove it was Article 74 to 97, 74 to 97. And so that's completely off the table. So there's no more mergers, filiale, integration. We're off. So we remain an independent organization, non-for-profit, as we were, as agile as possible, and we're extremely pleased. So, over the past, I think it's past 2 or 3 days, this is the perception that has been floating around, right? So that Transplant Quebec is not collaborative, we're not open. We were providing them with full pushback. But, we've been fully collaborative throughout this whole process with Bill 7. Let's just remember that we were faced with a position that was last minute, that was 180 from what we were expecting. So that's the first thing. The second thing is we proposed several avenues to Emma Quebec and to the government to say, give us what is the financial objective here? The health, not the health minister, but the Conseil du Trésor president said 35 million for 40 organizations. So when we met her, I said to her, I think we're allowed to know what is the amount for Transplant Quebec. And she said, well, there is no amount. There was no amount. So, okay, fair enough. So if there's no amount, then what is it that we're looking at, right? So we sat with them. We sat with Emma Quebec. We tried to find solutions. So to say that we were not collaborative, I think that's not fair. The second thing is, to clarify is, for me, if we're in disagreement with a proposal to dissolve, to merge, to fuse, to whatever you want to call it, to integrate Transplant Quebec, with an organization that's completely different from ours, right? That's based on logistics, that's based on inventory, that's based on commercialization of its products. It's not because we're in disagreement that we're not open and we're not collaborative. It's my responsibility as the president and CEO to voice this non-agreement, if you will, because it's going to entail a lot of risks for the population. And it's my duty to protect the patients and their families, the Quebec population, that this is not a good idea. And so to me, it's not a stance of resistance. It's just fulfilling my responsibility. So I think that maybe the third thing is, I don't know if you were aware of the letter that was read in the travaux parlementaires yesterday. But one of the things that was mentioned in the letter from Madame Duranceau to myself is that she wanted me to work with the Ministère de la Santé. Well, just for the record, this has never been interrupted. I carry meetings with the deputy minister on a regular basis, with la direction du ministère on a regular basis, and we have a director that sits on our board. So, perhaps the messages were not communicated properly, but just so you know, we've never stopped collaborating.